Ma'am, please start. Thank you.
Thank you, Pallavi Madam. And good evening, and I welcome you all on behalf of Maha IAP for our session on breastfeeding. Today is Maha IAP's Lactation CME, held in honor of World Breastfeeding Week 2025, which is celebrated every year from 1st to 7th August. I am Dr. Amruta Shirodkar. I am the Executive Board Member of Maharashtra IAP, and today it's truly an honor for me to moderate this very important session. As we mark World Breastfeeding Week 2025 with the theme Prioritize Breastfeeding, Create Sustainable Support Systems, we are reminded that breastfeeding is not solely a mother's responsibility, but it has to be a collective commitment from families, from healthcare providers, from workplaces, and also from community at large to ensure that every child gets the healthiest possible start. I'm equally delighted today to share this responsibility with my co-moderator, Dr. Sucheta Pofle Madam. I welcome her. She is also the Executive Board Member of Maharashtra IAP from Dharashiv, Marathwada. And may I invite you, Madam, now to join me as we take this session forward.
Thank you, Amruta. Indeed, today's program is star-studded. I welcome on behalf of Maharashtra IAP, Dr. Neelam Mohan ma'am and Dr. Vasant Kharatkar sir, both the serving president as well as the future president of IAP. Along with that, today's experts are Dr. Sanjay Prabhu sir and Dr. Sushma Malik ma'am and our own Sanjay Pakmode sir and Dr. Amol Pawar. Indeed, it's an honor for me to co-host with Dr. Amruta. Dear IAPians, we studied breastfeeding during our undergraduate days, postgraduate days, super specialty days, and it's our day-to-day practice also to indulge in the breastfeeding and the guidance to the mother. Indeed, it's our first priority. A single insensitive statement by anyone from our staff, from our gyneco and our pediatricians, बच्चे को दूध नहीं आता है ना तो ऊपर का दे दो. It will literally turn the world upside down for the mother as well as the child, newborn baby. So let's all immerse in this today's knowledge, wisdom, and enjoy this program of breastfeeding. In this webinar, we are fortunate enough that our innovative, dynamic, and proactive national president, under whose initiative we have this very interesting programs such as IAP Ki Baat, Community Ke Saath, and Bye Bye Anemia. Our beloved President Vasant Kharatkar sir is here to guide us. Sir, please share your Man Ki Baat IAP Ke Saath.
Thank you, Madam. Yeah, good evening all, and wish you happy breastfeeding week celebration week. Actually, it's breastfeeding week celebration week. It's really a great pride to have on this platform, not as a president, but as a Maharashtra IAP member. Really, Maharashtra is doing a great job, great activities and everything. Congratulations to Dr. Sanjay Pakmode, Dr. Amol Pawar, Dr. Suchita, Dr. Amruta, and all the team, enthusiastic, everyone. Today, really, I want to thank today's speaker and those who are motivated. I will say basically motivated. See, once we get motivated, then everybody will get motivated. Our issue is that how to tackle with the obstetrician. That is our issue, because we just because of our busy OPD and all this our schedule, whenever we go in a to have a cesarean call or any newborn baby call, our issue is that our colleagues don't want that. We should talk more with our mothers. That though we are going for it, they say yes. You see the health of the baby. What is whether it's abnormal, normal. So that mentality should get changed, and that's why we need a program like a Sat Sat. Sat Sat means it's an obstetrician and pediatricians unity. So then only there's basically we have to change the mindset of those people, because see, first 1,000 days we say that's very important. The rule of 10 for any obstetric nursing home or pediatric nursing home, that initiate breastfeeding within 30 minutes, that is the golden period and everything, they should learn first. So my request to all and each pediatrician that we should have a combined CME, at least combined program. We are doing in Nagpur. Nagpur always do that. We always take one good rally for the people There's a road rally by in association with POXIL, and that's really giving the great impact. And they are really accepting that we have to listen pediatrician that at least here also for the breastfeeding. There is no need to tell that what are the advantage of breastfeeding and what we should do. Our thumping rule should be that we have to say that breastfeeding, breastfeeding, breastfeeding. That's all. स्तनपान इज अमृत. ऐसा है, ब्रेस्ट फीडिंग इज अमृत. अपन पेपर में लिखते बोलते भी, पर अपन कभी भी इंसिस्ट नहीं करते. जैसे रोशनी मैडम ने बता रही है, मैडम ने बताया, सुचित्रा मैडम ने, कि अपना कोई तो स्टाफ जाके बोल देते. पहला तो जैसे बर्थ हुआ वैसे डब्बे के फार्मेसी में जाके कोई तो भी फॉर्मूला लेके आता है. पेरेंट बोलना ही नहीं पड़ता, पेरेंट को पेरेंट लेके आता है. आर यू रेस्ट्रिक्टिंग दैट? आर यू सेइंग नो? होता ही नहीं है ऐसा, बट इट शुड हैपन रियली. बैंड टू डब्बा एंड स्टार्ट ब्रेस्ट फीडिंग. थोड़ा इनिशियली तकलीफ होता, सब होगा, अपने को तकलीफ होता. वी हैव टू ट्रेन अवर ऑल health worker staff, our these health workers, that they should be ready. तो उनका education बहुत जरूरी है. So start should be from your own hospital. Then only we can success. I really want to once again congratulate Neelam madam. Warm welcome as a president and as a Maharashtra IAP member to you. Really, thank you. Once Roshni madam also for joining this for a noble cause. Once again, I wish you all the best for the success of this program. Thank you.
Thank you so much, sir, for those inspiring words. Now it's my absolute privilege to invite our dynamic president-elect of IAP, Dr. Neelam Mohan madam. I'm sure madam, with her visionary leadership, she has multiple plans for the next year to take IAP to even greater heights. Madam, may I request you now to grace us with your thoughts and inspire us with your words. Dr. Neelam Mohan madam.
Thank you so much. And I would like to sincerely congratulate the Maharashtra IAP. They are doing phenomenal academic events. And I love the title, Friday Ka Panch Maharashtra Ke Sang. And from the outset, Dr. Pakmode and Amol, great work you all doing. And I'm very impressed with the experts that you've had today, whether it's Sanjay and Sushma or Sucheta and Amruta. We are seeing how beautifully she is comparing. And to see that you've kept an amalgamation of experts from various parts of Maharashtra, whether it is Mumbai, Pune, or Nasik. And we have experts like Roshan and Rujuta, Surbi, Surbal, and the other people who you've beautifully kept it. And I would like to endorse with what Vasant was emphasizing. The statistics in India show that the first 48 hours, it is the gynecologist who are going to have the influences. And whatever they say is going to be much more influential than the pediatricians who come later in the life of these mothers and children. So I guess today's CME is going to be extremely useful, not from an academic point of view, not from what we are trying to say about focusing that IAP, we are talking and we are doing great academics. I think this is a policy and advocacy type of a meeting today that we should emphasize, so that irrespective of the branch, whatever you are, whether you could be any branch, but since you're a pediatrician with whatever super specialty, it is your utmost responsibility to understand various simple facts, about nipples, inverted, and small breast, and mothers, the myths. I have a small breast, so I'll produce less milk. I have two twins, I have triplets. Those funny doubts which they may have, that how can I produce? I had a mother who said, my baby is 3.5 kg, and my pediatrician told me that your milk may not be enough. It's a big baby, and you'll need to give a couple of top feeds. I didn't know where to look at, whether it was the mother or we ourselves were responsible, that one of our colleague had to say that. So these type of meetings are not only to educate but also to ensure that we are giving advocacy. And I would just say simple word, that which I did videos. I'm not sure how many of you would have seen, but breast milk is not nutrition. Breast milk is not about paid bharna of a mother to the baby. Breast milk is all about nutrition, about immunity, about emotional connect, and about lifelong health. Because we know that children who've had breastfeeds have less likely to develop metabolic health issues in future. So in short, Stanpan, as Vasanji said, is the right way for all of us to advocate. And I'm very eagerly waiting for the great tips, the various parts of the country and under the banner of IAP doing this to empower each pediatrician and the mothers at large, so that the exclusive breastfeeding rate, which are still, some studies talk about till 5 months, 63%, and less than that if it comes till 6 months. So we want our exclusive breastfeeding rate to go much higher than what we are. We don't need to be happy that, yes, it is more than the global average, but this is India. India जहाँ मातृभूमि को हम माँ समझते हैं, तो वहाँ माँ को हम क्या समझेंगे, क्योंकि वो बच्चे का जीवन बना रही है अपने दूध से. With those few words, once again, I congratulate the organizers for this lovely meeting and best wishes for a stupendous rocking show. Thank you once again for having me over.
Thank you, madam, so much for those really encouraging and motivating words. I think you truly emphasized on the fact that every mother's superpower is that she can breastfeed. With that, moving ahead, I would now request our Maha-IAP President, Dr. Sanjay Pakmode, sir, to say a few words.
Thank you, Amruta. Respected Dr. Vasant Khalatkar, sir, President CIP 2025. Respected Madam Neelam Mohan, President-elect 2025, CIP. And today's expert, Dr. Sanjay Prabhu, sir, and Sushma Malik, madam. And moderators, Dr. Suchita Pofle, madam, and Dr. Amruta Shirolkar, with all the 5 faculties. I welcome you on the Maha-IAP platform. Both the president has already highlighted the importance of the breastfeeding and as well as told how the advocacy is important, because we know just writing on the prescription exclusive breastfeeding for 6 months is not enough. You have to counsel, and that is the work of we pediatricians. And no doubt it starts from the beginning, antenatal period, right from the gynecologist. And as Madam Suchita has said, one wrong sentence can create upside down. And that is a very much truth, because here all the people should be involved in the process of the breastfeeding for making a successful breastfeeding and the exclusive breastfeeding. Right from the gynecologists, pediatricians, the staff involved in the means either at the gynec place, at pediatrician's place, and even the family members, support from the family members, all the members, so that even the father also, they need a support so that we can establish a successful breastfeeding, so that as sir and madam has said, we can make a healthier baby, and we can definitely invest in the future of the baby. And that is a definite rule, that is a role of our pediatrician is much more there, even though whatever faculty we may belong, because it is we are dealing with the baby's health in the future. And if in the beginning only our few minutes can definitely invest in the future of the baby, our words, our counseling definitely help the mothers in building that confidence. I can feed a baby, I'm getting the good secretions, I can manage with my feeds only. So, and for this we have to best tell her 2-3 things. That is, we know in this world where there is a patience, we don't have a patience. We now need everything like the apps of the mobile. So we have to tell the mother, you should have a patience, you have to practice, and persistently you have to do the things. Then only you can establish a successful breastfeeding. So there are so many mnemonics involved with the breastfeeding, so many mnemonics. So all these mnemonics are very much important, and right from the ANC period, if we tell these particular things and we can take in the confidence the ops and gynec people, then only we can achieve our motto of successful breastfeedings, and then only we'll be able to do the justice with the baby and with the society. So with this, I once again invite all of you for the MahaIP platform. I welcome you to the MahaIP platform. I again thank you for joining the MahaIP platform and accepting our invitation as a guest as well as experts. Thank you. Over to you, Amrita.
Thank you, sir, for those words of wisdom. May I now request Dr. Amol Pawar, sir, Secretary, Maharashtra IIP, to say a few words.
Thank you, Amrita. So my job is very easy. Already all the three our leaders of Maharashtra IIP as well as National IIP, they have elaborated about breastfeeding week and its importance. And so I welcome once again to Dr. Vasant Khalatkar sir, President National IIP, and Dr. Neelam Mohan ma'am, President-elect National IIP. You both are doing wonderful work for all the pediatricians, for all the community, be it academic activities or social activities like IIP की बात community के साथ, and various others like the social films to educate our adolescents and other children. So I also welcome Dr. Sanjay Prabhu sir, who is senior consultant at UNICEF and Wadia Children Hospital. I also welcome and thank Dr. Sushma Malik ma'am and Sanjay sir also. Sushma Malik ma'am is President BPNI. So both the stalwart expert we have got for today. So we are very much thankful to them and all the speakers, Dr. Rujita, Dr. Roshni ma'am, Dr. Sharwari, Dr. Arti, and Dr. Sulba, and both the moderators, they are doing wonderful comparing as like Dr. Neelam Mohan ma'am already highlighted that thing. And today's session will be very useful one for all the pediatricians, all as well as PG students, and all the people who are working in neonatology. So I once again welcome you all and all the attendees. Almost 260 people have joined. So this speaks a lot about the speakers and the topics and experts and what Maharashtra IP is doing for its members. So once again, I welcome all the branch office bearers and all the executive boards member of Indian Academy of Pediatrics. And I would like to tell Dr. Neelam Mohan ma'am that we all are watching your educational videos, which are very thoughtful, and you are devoting your precious time, as well as Dr. Vasant Khalatkar sir is also giving his precious time to Indian Academy of Pediatrics and its members. So keep doing, keep making these educational videos, Neelam ma'am. So thank you once again for joining, and over to you, Dr. Amrita.
Thank
Thank you,
you.
Dr. Thank you, Dr. Amol sir. I would now like to request Dr. Sucheta ma'am to introduce our experts for today.
Thank you all the leaders of National IIP as well as State IIP for motivating us. We are always with you, sir. And breastfeeding was, breastfeeding is, and breastfeeding will be our priority henceforth also. So I want to introduce our esteemed guest today, Dr. Sanjay Prabhu sir, a senior UNICEF consultant and in charge of the State Center of Excellence in Pediatric Nutrition at Neoplus Children Hospital. He had 10 publications and had been conferred upon prestigious Dr. Anandibai Joshi Award for IYCN project. I invite Sanjay Prabhu sir to guide us about this program. Sanjay Prabhu sir.
Yeah, good evening, everybody. It's a great honor to be amongst all of you during this World Breastfeeding Week to share our thoughts on what is the most important nutrition that the child will receive in the first 1000 days of life, along with complementary feeding. As this week is only on the breastfeeding, we'll be highlighting the breastfeeding part of it. But important to remember that besides nutrition, as Dr. Neelam Mohan mentioned, it provides you immunity, creates bonding between the mother and the baby, And most important is early child development. Now, early child development is very much linked to the nutrition. As you know, the maximum growth of the brain occurs in the first 2 years of life. So, if breast milk is missing from the nutrition, even the brain growth suffers. So, all in all, there is nothing like breast milk available as a nutrition for any child. Thank you.
Thank you, sir, for those inspiring words. I will now introduce our second expert for today, and it is my absolute privilege to introduce a towering figure in the field of breastfeeding and newborn care, Dr. Sushma Malik, Madam. Madam serves as the board director of International Lactation Consultant Association, and she is the president of BPNI Maharashtra. Formerly Professor Emeritus and head of the Department of Pediatrics and Neonatology at Nair Hospital, Mumbai, Dr. Sushma Malik's ma'am's career is adorned with numerous awards, honors, and impactful publications. Her deep expertise spans neonatology, breastfeeding, lactation management, and kangaroo mother care, among many others. We are truly fortunate to have you, Madam, today with us on this very important session on breastfeeding. And I would like to request Madam to say a few words before we start the talks. Over to you, ma'am. Sushma Malik, Madam. Madam, please unmute.
I'm Pallavi ma'am. Please unmute Sushma ma'am. Pallavi ma'am.
Yes, sir. Yes, sir. Already
Please
done.
unmute
Already
Sushma.
done.
Yeah. Yes.
Sushma
Thank
ma'am
you. Thank
is
you.
already closed. Yes.
Thank you very much firstly for unmuting me. I was desperately trying to unmute. At the outset, I would like to thank Maharashtra IIP branch to really invite me on this podium. And I'm so happy that we have a large attendance who wants to hear about breastfeeding, though we really know so much about breastfeeding, and we still need to continue to upgrade ourselves. Based on this year's theme, which is, prioritizing breastfeeding and creating a sustainable, support systems, I would like to say that we need to support mothers right from when she is pregnant to when she gives birth in the postpartum period, whether she is having any problems. And this support continues, right throughout the first 6 months and then during weaning. And adding the complementary, I shouldn't be using weaning, and then when we add the complementary feeds. And for the next 2 years, at least, we should ensure and even more about breastfeeding. And this support should not just be restricted here only at the hospitals, but also at home, in the communities, and in various settings, whether it is in emergencies. We all know that we are facing so many wars, and we need to see that we support mothers in all possible settings through all emergencies, as well as when they go back to work. I think this is very important, especially in this day and age when we are having so many working mothers. I think that is a very important, sustainable support that we need to give to them. I think with that, let us start our CME. Thank you very much, Sucheta.
Thank you, Madam, for those inspiring words.
1 minute, Amruta.
Yes.
I forgot to mention today's MMC observer, Dr. Sagar Bhalera. He is president of Nasik IIP. Over to you.
Yeah. Thank you, sir. So with this, now today we'll begin with our Friday Ka Punch sessions. And may I now invite our first speaker, Dr. Roshni Sodhi. She is from Chhatrapati Sambhaji Nagar. She is a pediatrician, a neonatology fellow. She is ACLP and IBCLC certified. She is into private practice and is also a visiting consultant. Today, we'll have our first talk from her on antenatal breastfeeding education and counseling. Over to you, Dr. Roshni.
Thank you so much. At the outset, let me thank Maha IIP for having such a CME, and I'll just share my slides in the meanwhile. Yes, I think they're up there. So it's a pleasure. More than that, it's an honor to be amongst such stalwarts from IIP, from Maha IIP, and my teachers, Dr. Sushma Malik and Dr. Sanjay Prabhu sir, from whom I've also learned a lot about breastfeeding. So when we talk about lactation success, I think we have to understand that the mothers are the main stakeholders. Nevertheless, the influence also comes from the spouse, from the family members, from the relatives, and everyone around. So if we are able to equip these people with the right knowledge, if we are able to provide them the right skills, If we talk to them about the troubleshooters and their solutions and make them self-sufficient, I think we would have done a good job. And all this is provided by antenatal breastfeeding education. So let's begin with simple concepts. Why A and B? When should we give A and BE? Who should be the one who's providing it? And what should be the content of our breastfeeding education? The why. We all know the facts. We all have been discussing that breastfeeding rates and what the data is also telling us. Our own National Family Health Survey says that the initiation in the early time, which is within the first 1 hour, is less than 40%, and this is happening when more than 90% of deliveries are taking place in the hospital setups. Exclusive breastfeeding, we have been advocating for 6 months, but no, we don't have a very strong rate there. And the total duration of breastfeeding falls down because there are issues which come up and there are no solutions that the mothers know about that. If we tell about the recommendations, the WHO, the IAP, the AAP, and all big organizations have always been telling that antenatal education, antenatal care and support is an important part of getting success of breastfeeding. Even in our 10 steps, the third one is totally dedicated to antenatal care. But the fact is, the education is coming from the Google Baba, from WhatsApp University, and from the peers. It's not that people are not seeking information. They are seeking information. So antenatal, why we want to give A and B is because they are seeking knowledge. And besides providing the knowledge, we need to understand what is the family's perspective, what is the thought process that they are coming from. We need to identify the support persons because as we all know, they want to breastfeed, but they don't know the technical knowledge. There are no support personals available in the initial days who can support these mothers in breastfeeding journey. We also need to dispel their myths and misconceptions so that they are more knowledgeable about the advantages and all the things about breastfeeding. We need to provide targeted skill training. Every mother needs to know that it is a skill to breastfeed. Though the newborn is born with all the neonatal reflexes that are required for breastfeeding, but the mothers need to learn. And just like any other skill, they need to have training for it. And that can be provided in antenatal education. That builds the confidence of the families to go ahead. So after coming to the why we need to do it, let's go to when it should be done in the antenatal period. So ideally, the problems come forward in postnatal period when they're not able to take the right position, they don't know the techniques, the skills, they don't know what to monitor, how to understand whether the baby is adequately fed. So all this comes up in the postnatal period. But mind you, that is not a time when a mother is really ready to learn something new. Because at that period, she's also undergone through a process and it's not easy to learn new techniques. So ideally, antenatal period, if we give them the right knowledge and all these things, it would work better. So yes, first trimester can be one place. Second trimester can be when we can teach them. But for sure, by third trimester, they should be having all their education done. Anytime they come to us, it's not that it should be done only at this particular periods. Anytime they come to us for any other reason, they're seeking help for any other reason because they've had a bad experience in the previous pregnancy about breastfeeding, or they want to know whether I'm a working mom, how can I continue breastfeeding, or they say I'm going to have twins, will it be sufficient? So anything they come to, we should talk to them then and there and sort it out. We should not postpone that episode, but ongoing education, slowly introducing the concept and taking it to the end. Everything in a visit, in every visit talking something about it. I think that may be a better idea because then there is a journey of education that we are taking them through. So first trimester, second trimester, third trimester, these are the times that they're definitely visiting some hospital setup. So first trimester may be a good time to just start. So what is your plan? How do you want to go ahead? What have you decided about feeding your baby? So what are the practices in your family? And then sometimes they just ask, ma'am, I don't know anything. And, can you tell me what is good? What would be good? So we can authentically then tell them that, yes, breastfeed, breast milk is the best milk for you, for your baby. So we can give those recommendations also. We can share the advantages of breastfeeding. We can also address their barriers in this initial phase because they feel, I'm from a joint family. How will I feed my baby? I need to travel a lot. How will I feed my baby? I'm going to work within 3 months. How will I feed my baby? So these are the barriers which stop them from even starting and initiating the breastfeed. So here we can teach them and remove all these misconceptions from their mind and equip them in some way. Always, it's a good point to involve some support persons from the family or the relatives from the beginning, so that the language that we are speaking goes in 2 years. Because sometimes we know post pregnancy, the mothers are not in a condition to remember everything, and someone else who has heard can support her, guide her through those emotional and mental turmoil phases. In the second trimester, we can go a little ahead. We can talk to her about some role models. We can tell her some success stories, see how this person has breastfed. We can also recommend to them to take a proper course at this time. Even if they're not willing to take a course, we can talk about the basics of lactation, how the physiology is, what is the anatomy, what are the changes in the breast taking place, how the demand and supply feedback mechanism is going to decide how much milk is there, when should you feed your baby, how do you know that there is adequacy of milk, all these concepts. And third trimester, definitely using dolls, using props, we should teach them the skills of latch, positioning, hand expression. Because imagine a mother who has never held a baby and directly after her cesarean, you hand over the baby and tell her to breastfeed. It's not fair because she has never even held a baby. So doing that practice on models beforehand again gives them a lot of confidence. Discussing with them about the mode of delivery, because that also impacts a lot about the initiation of breastfeeding. Talk to them about common challenges, because sometimes just because of breast engorgements, just because of bad latch and some nipple pain, they are going to withdraw from breastfeeding. So if we already talk to them about it, they know they are prepared for it. So this is our time that we should empower the mothers. So this is the when about A and B. Now let's go to the next one, which is who should talk about it. So the resource person can be anyone. An obstetrician can talk, a pediatrician can talk. Why can't we visit the ANC clinics and talk about newborn care and breastfeeding? Any in-hospital residents can talk, the nurses can talk, but I think a person who's talking should be trained in lactation. And lactation professionals per se can be a good set of people who can take over this, or we can also learn the basics and everything and then teach them. So lactation knowledge is important. The communication skills is important, because mind you, we are dealing with adults. Adult teaching principles are different. So use of videos, use of models, use of charts, all these things can go a long way in creating the impact that we want to create. Who should take, we have discussed, but who should attend? Besides the mom whom we want to train, the partner should be available, because he is a very big support person during this journey of the initial phase. And everyone has recognized it. That's why we have paternity leave also now. The family members are important. If they can attend the antenatal session, that will be great, especially the mother and the mother-in-laws, who are the main influencers at that time. I would even go a step further. Now people are employing japa mates, dais, they're all booking them, planning them beforehand. So why not call them also and train them also about these concepts, so that they don't misguide the mothers. So we have talked about the why, the when, the who. Yes, some resources we can provide. Instead of going to the Google Baba WhatsApp, let them give them authentic information sources. You want to go on social media, please see these sites. These are going to help you in giving good information. The last part, let's go to the what. Of course, our aim is to provide the right knowledge, the right skills, so that she can take an informed decision, and she's having that concepts of self-efficacy. I can do it. I can do it. She should not have that guilt that I don't have the knowledge. And that preparedness goes a long way in initiation and continuation of breastfeeding. Some sample examples. You can show them these pictures. What are the advantages to the baby, to the mom, to the family, to the society? You can also talk to them about disadvantages, because people very easily come forward with formula. So once they know that there is something like a disadvantage, they may think twice before starting it. Bottle feeding, we see it everywhere. So we need to talk about what are the risks of bottle feeding. We can also talk about these concepts, how the size of the stomach increases. That's why the milk supply is low in the initial 2 days. Then it picks up. The body, the milk dynamics, naturally it's going to catch up. But we don't need to be worried if we are not seeing 2 or 3 drops coming on the day one. So all these concepts can be touched upon. Hunger cues. They don't know when to feed their babies. They wait for the baby to cry to start initiation. So that can be taught. Breast crawl, such an important thing to discuss in the period of antenatal, so that they know suddenly when the baby is born and someone is placing a baby on your chest, they should not be anxious and they should not be worried. So talk about it. Different positions that she can use according to her comfort, and they're all very good positions. What is a latch? At the end of the day, it's this thing that they need to learn, this skill they need to learn. What is a correct latch that their baby is attaching well to them and then the milk is getting transferred? Also talk about engorgement, sore nipples, flat nipples, mastitis, so that they know these things occur and it is treatable, it can be handled. That itself is sufficient. So with that, we also can do certain other things. Like we always say, IMS Act says, WHO Act says that we should not put up displays of formula. Why not put up these displays everywhere? Put these in the files, give these pamphlets, like see the size of your breast doesn't matter. Newborns have to feed at night. Babies do not need water even if it's hot. There are so many advantages of giving your milk, etc., etc. These can always be put forward so that mothers feel, oh, this was in my mind, I couldn't ask it, but it's written there. So it's many people who are thinking about it. So there are many more things like this we can add to our antenatal breastfeeding education. The aim is that if we do this, I think it's a big tool in our kit to sensitize, to equip all the new mothers so that we can have better outcomes of breastfeeding rates, and also the quality of breastfeeding can improve. Thank you so much. I think I kept my time.
Thank you, Roshni.
Thank Thank you, Dr. Roshni. I think your session was on time and a very, very practical session, more like an anticipatory guidance. I hand over to the experts now for their comments. Sushma Malik, madam.
Thank you very much, Roshni. And I think it was a superb lecture covering almost everything. And if the organizers allow, I would like to ask one question from you. I mean, you've done stupendously well. You covered how we should start from the first trimester, go to the second and to the third with more details in the third trimester. How would you ensure? I want to ask you only two little questions. One is, how would you ensure that these practices are done very regularly by our obstetricians in various settings? How would you ensure that?
So, ma'am, ensuring is a policy making matter again. So,
Absolutely.
wherever we are working, having collaboration with these people, whoever are responsible, whoever is the stakeholder, right from the management, the policy, the obstetricians, the pediatricians, the neonatologists, and the nursing staff and the nursing heads. If we can all come together on one table and make a policy for breastfeeding, having a breastfeeding policy, I think that would sort out the problem.
Thank you very much. And one more question that just strikes me. Would you examine the mother's breast? I know it is a little controversial, but just a little bit, a line or two. Should we examine the mother's breasts or not in the antenatal period?
My personal opinion is yes, ma'am. Someone should examine the breast of the mother, be it the obstetrician, be it the person who's taking antenatal class.
Okay,
Because,
excellent. So
yeah,
the
thank
breast
you.
examination should be done not to, intimidate them.
Yes.
You must take their consent. And especially in cases who have faced previous problems, I think a breastfeeding examination should be done. And the aim is to help out in the success with early support and reassurance. And therefore, it should be done. I hand over to Dr. Prabhu.
Thank you, Roshni, for an excellent session. Now, there are few points I would like to highlight here. Is that the third trimester is the best time to talk to a antenatal mother. I agree with you, first trimester, second trimester, but don't give too much information. There will be an information overload, and also see what sort of audience you have. See, what you talk in a big city is something different. What you talk in a rural area is something different. What you talk in a government hospital setting is something different. So you will have to tailor your antenatal counseling to what place you are giving the counseling skills. Second most important thing is that we were talking about obstetrician and pediatrician collaboration. At your antenatal sessions, at least during the third trimester, we advise at least 2 sessions. At least at one session, the obstetrician should be there. at least at the start. So the parents, the would-be parents and the family know that the obstetrician and pediatrician and maybe the lactation counselor are all on the same page, because the mother is more interested to hear what the obstetrician wants to say. She has been following up with this man or this lady for the past 6 or 7 months, so his word also is very, very important. Then other thing which we always insist on is only talk about the early days. Don't go on beyond 14 days, 15 days. We can always keep on talking to the mother after that, what is going to happen. So what information she requires is how she should be prepared at the time of pregnancy for breastfeeding, how she should initiate breastfeeding, information about breast crawl, position and attachment, how she has to hold the baby, how can she feed in lying down position, can she feed in always there's a misconception that you have to feed in sitting position. All these small things are some things which are always disturbing them, and what to do if there is engorgement and how to express milk. So these are the only 5 or 6 things which they should know. And how do you know that the milk is adequate? And you talked about the stomach size, you also talk about the stooling, that when do you know that the milk has become adequate? When you are having yellow stools, the urine output has increased, and this does take time, because some mothers start expecting that as soon as I'm feeding, everything should occur on the first or second day. So, and what are the danger signs you should be worried about? If the baby is not feeding, baby is going to sleep too much, and also the role of relatives. The role of relatives is to hand the baby to the mother and not just roam around with the baby all over the ward trying to make him quiet. So, and always have to tell them that crying is the last sign. You can't wait for the child to cry and then offer mother's milk. And another important thing which I always feel is another group which should be ready with at least the basics of breastfeeding is the adolescent girls. Whenever we have time, some introduction to breastfeeding also should occur at the adolescent level. So if you are talking to any of the adolescents at any time, please also make it a point to tell them that what is the best for their baby. Thank you.
Thank you so much, sir and ma'am, for the inputs.
Thank you. Welcome.
Thank you, madam and sir, for those valuable insights. Moving on, we'll move to
Amruta,
our... Yeah.
Amruta,
Yes.
there is, we'll take one quick comment
there's
or
a hand
question
raised.
from
Yes,
Raghu sir.
sorry.
Raghu sir, please, quickly. Unmute
So
yourself.
please unmute.
Pallavi ma'am, please unmute Raghu sir.
Yes, sir. Permission given already.
Yes.
Yeah, Dr. Roshan does a wonderful lecture. I just want to emphasize on one point. I think in the first time we should ensure talking about maternal nutrition also. That's also important. We've been talking only about the baby. I think we need to talk about maternal nutrition also. That's my feeling.
Yes.
Thank you, sir, for the comment. Yeah. So we'll move on to our second speaker now. So our second speaker for today's session is Dr. Aarti Patil from Pune. She is a pediatrician with experience in general pediatrics and critical care. She has worked at multiple places in Mumbai, Pune, Nasik, and currently doing private practice at Pink and Blue Children's Clinic, Pune. She will be giving insights on importance of early initiation and STS, that's skin to skin. Dr. Aarti?
Yes.
You can share your screen, please.
Aarti ma'am, are you there? You can share the screen now.
Yeah, I'm here. I'll just share the screen 1 minute, okay?
Please. Thank you.
Arti ma'am, any problem? Any problem in sharing? Dr. Arti.
Can you unmute her?
Ma'am, permission is already given.
Already she is
She's
co-host.
already co-host, yeah.
Yeah.
She is already
Should be
All
able
are
to
co-
share the screen.
Yes. Mm.
If she is not able to join, shall we take the
Yeah.
next speaker for time being?
Sure, ma'am.
Arti ma'am, please inform us, please.
I think you can make a call to her. Just make a very quick call to her.
Oh,
It'll
yes.
be.
Yes.
I think she's unable to unmute also.
No, she is co-host, so it is not a problem, ma'am.
Amol, you take the next speaker and
Yeah.
get her PPT on one
Yeah,
of you
yeah.
can take the PPT.
Yes,
I
sir.
think she has just unmuted. Dr. Aarti, are
Yeah,
you able
yeah,
to share the screen?
I'm here. Just a
Please
minute.
share.
There was some trouble with the screen sharing. So I think,
Yeah. Please share immediately.
yeah. Sorry for
Yes.
the delay.
Yeah.
It's
Make it a full screen. Yes. Please make it a full screen.
yeah.
Yes.
So I think now my screen is visible to all.
Yes.
And sorry for the delay. Very good evening to all the seniors and colleagues. I would like to thank Maharashtra IIP to give me an opportunity to present a talk on this lovely topic, which is very close to every pediatrician. So my topic for today is importance of early initiation of breastfeeding and skin to skin contact. So I'll start with a lovely quote. This is says that the provision has been made. The provision has been made for the infants to be fed upon their mother's milk. They find their food and their mother at the same time. It is a complete nourishment for their body and soul. It is their first introduction to the great truth that infants' true relationship with the world is that of personal love and not that of mechanical law of causation. This is a lovely phrase written by Rabindranath Tagore ji. So, is breastfeeding guided by time? I would say yes, only in the first hour of birth. So, initiation of breastfeeding immediately after birth and within 1 hour is called as early initiation. In the later part of life, there should not be timed feed, but it should be feeding on demand. So, how the initiation is done? The breast crawl seems to be the best and the easiest method to implement the recommendation to initiate the breastfeeding within an hour of birth. It is an easy and comfortable method which can be performed in any birth setting. In case of premature or low birth weight babies, kangaroo mother care is done whenever possible. KMC also emphasizes on skin to skin contact. So, what is breast crawl? Breast crawl is a natural instinct displayed by the newborn babies, wherein a newborn is placed between the mother's breast and abdomen. The newborn slowly moves towards the mother's breast and search for food shortly after birth. It is a self-attachment process that aids in initiating breastfeeding and bonding between the mother and the baby. The baby uses the senses of smell and inborn reflexes and inches towards the breast, latches on, and begins to feed. This act of breast crawl supports early skin to skin contact and also bonding. I have shared a link to a video of breast crawl in this slide. In case I would request all the participants to visit this link whenever the time permits. So, what is skin to skin contact? It is a method of nurturing care where baby is naked and cuddled in a safe position between a mother's bare chest. Skin to skin contact should be immediate, continuous, and uninterrupted immediately after birth for all newborns and preterm whenever feasible. Skin to skin contact can also take place whenever baby needs comforting or calming down. It is vital in neonatal units also, which is termed as kangaroo care, where it helps to The parent, it is not necessary the mother, it helps the parent to bond with the baby and thus support better physical and developmental outcome for the baby. So I have shown an algorithm of essential newborn care. Here I will just take up the stable newborn. So the protocol is almost same for the deliveries done in the labor room, which is the normal vaginal delivery, or for the cesarean section also. So as soon as the baby is delivered, please deliver the baby onto the dry sterile cloth draped over the mother's abdomen. In case of cesarean, it could be on the thighs of the mother. Call out the time of the birth and sex of the baby. Dry the baby within 5 seconds after birth, like wipe the eyes, mouth, nose, face, head, back, front, arms, and legs thoroughly. Check the breathing while drying and remove the wet cloth. Position the baby immediately prone on the mother's abdomen or chest and begin the skin to skin contact. Cover the baby with the second dry cloth in case it is the environment advises to do so. Do not do routine suctioning. In case the baby is not stable, we will go ahead with the resuscitation. Continue the skin to skin contact on the mother's abdomen and chest and clamp out the cord, and after the pulsation stop between 1 and 3 minutes after birth. Do not separate the stable babies for examination, oxygenation, or suctioning. Maintain the uninterrupted skin to skin contact for more than 90 minutes unless the baby has any difficulties in breathing or there is some changes in the vital parameters. Counsel the mother on the breastfeeding cues like putting out the tongue, the salivation, and the movement of the baby, so that she can just nudge the baby towards her nipple and help in the attachment and positioning. Please monitor the baby and the mother throughout this process of skin to skin contact. And once the baby has been breastfed properly, then we can examine the baby thoroughly for whether the baby is well, pink, warm, and then we can do the other things like weighing the baby and keeping the record maintenance. What are the precautions to be done during skin to skin contact? So monitor the mother and baby for first every 15 minutes in the first hour and maybe every 30 minutes in the second hour to ensure that they are stable, both mother and baby. Monitor the baby for the color, temperature, the breathing pattern. Monitor the baby's movement and look for the feeding cues of baby, which I already mentioned. Ensure that the baby doesn't fall. Ensure that the neck is not flexed or twisted. The average time between the birth and readiness to feed is around 50 minutes. So let's come to the benefits of early initiation and skin to skin contact. For the baby, it helps in improved immunity. There is a boosting of immunity through transfer of antibodies through colostrum. The baby is exposed to essential bacteria present on the mother's skin, thus developing a robust immune system and GI tract for the baby. Skin to skin contact helps in temperature regulation. The warmth of the mother's body helps in temperature regulation of the newborn, thus decreasing the incidence of neonatal hypothermia and mortality or morbidity associated with it. There is also a better mother-infant bonding, thus emotional well-being in the future, and also reduces the abandonment of the newborn. It also helps in stabilizing the metabolic parameters, like it helps in better blood glucose levels and other biochemical parameters in the first hours of birth. It helps in faster and effective achievement of the baby's feeding skill. This process of skin to skin contact is also comforting to the newborn and helps in easy transition and acclimatization of the newborn from the intrauterine to the extrauterine existence. For the mother, it helps in releasing some beneficial hormones for which helps in quick expulsion of placenta and thus reducing the chances of PPH, thus decreasing blood loss and eventually preventing anemia. It helps in enhanced and sustained milk supply and long-term feeding. Earlier and better latch means that there are chances of less sore nipples. Breast crawl is also an early indicator of the neurological development and sets the foundation for healthy breastfeeding relationship. This positively impacts both mother and child. It decreases the pain for the mother during episiotomy suturing. And since the mother is an active participant in the baby's first exploration of feed, it increases her confidence in breastfeeding and many other aspects of parenting. So, what are the benefits of skin to skin contact in a baby who is shifted into the neonatal unit? It improves the oxygen saturation. It reduces the cortisol, that is stress level, particularly following painful procedures, because babies do undergo many procedures in the NICU. It helps in the growth of the child, that is the baby, and may reduce the hospital stay. It also improves the milk volume in a mother if the mother expresses following a period of skin to skin contact. So, to achieve the optimal results of early initiation and skin to skin contact, we should be doing counseling of the mother and the family and discuss the process antenatally, pre-delivery with the mothers and the relatives. We should also educate and orient the staff of the hospital as well as the whole team involved in the labor room. We should have a written infant feeding policy for the hospital. We should support the mothers to manage common difficulties during breastfeeding. No prelactal feed should be encouraged to the baby, and we should practice rooming in for 24 hours. So this critical time for every newborn counts. This critical time says that the longer the babies need to wait, the greater the risk is. So WHO, UNICEF, BPNI, along with the scientific community, recommend initiation of breastfeeding within first hour. This will help to take care of decrease in the neonatal deaths and thus helps in reducing the infant and under 5 mortality in the future. With this, I would like to conclude my slide, and I would just like to conclude it with two statements. And this says it all. Provide the vehicle, they know their way. Thank you. Thank you for a patient listening.
Thank you, Dr. Aarti, for that session. May we have expert comments on that first, on the session now? Dr. Prabhu, sir, Dr.
Yeah.
Malik, madam. Yeah.
Thank you, Aarti, for an excellent session. Now, 2-3 things I just want to highlight, that in the initial days after birth, we are not advocating demand feeding. We are advocating cue-based feeding, that you learn to recognize the infant's cues and then allow the child to breastfeed. Demand feeding is only advocated once the breastfeeding has been established well, and that may take 3 to 4 days in a multipara and maybe 4 to 5 days in a priming. So, recognizing the cues also is very important. What are these cues? The baby starts looking around, baby starts wriggling, bringing its hand out, or if the mother is nearby, then the rooting reflex is there. And crying is a very late cue. We should not wait for the child to cry. Second most important thing what you have to remember about breast crawl is that is probably the only reflex or only mechanism where we are using all the 5 senses provided to us. The touch of the mother, it hears the heartbeat of the mother, but the baby has been hearing this heartbeat for 9 months in utero. Then what it sees the dark areola, then the amniotic fluid which is there on the hand of the baby has the same smell as the Montgomery gland's secretions on the areola. So it smells that and it sees the mother. The baby has always been with the mother for last 9 months. Baby has never seen the mother, but that first sight of the mother calms the baby, that the baby is still in the proper hands. What we call in uh, our literature, that after the delivery, the first 6 months of life are the fourth trimester of the baby. It's still, the baby is still attached to the mother. That is why we advise exclusive breastfeeding for the first 6 months of life, because the baby is still fully dependent on the mother. So we cannot negate the and what we have already seen, that if you fail to initiate within the first 1 hour of birth, the neonatal mortality goes up, the bonding is reduced, and so many other problems crop up if you give the prelactal feeds or a formula as the first feed. So, initiation of feeding within 1 hour of birth is the single most important thing which is lacking as of now in our country. We saw only 40%, and that is a very poor rate. And some people also feel that cesarean babies need not be given to the mother within the first 1 hour, which is wrong. The cesarean babies also can be held in a football position. What is a football position? We'll show you later on. And the initiation can start within the first 1 hour of birth. Thank you.
Thank you, Aarti, for giving a very lucid talk. I do agree that we need to have early initiation and do skin to skin contact. And you have covered all that, including all the long-term benefits, the short-term, as well as, the immediate benefits of doing SSC. What I also want you to highlight every time, at least to our medical personnel, and to some extent, even the parents, that when we are doing skin to skin contact, you have to be very, very careful of sudden unexpected postnatal collapse. And that is really very important, that there is somebody who is observing for those 60 to 90 minutes when they are giving skin to skin contact. And I think they should always be taught and told. So for giving the right skin to skin contact, you should ensure that the baby's head is turned to one side, and the neck is slightly extended so that the airway opens. You have to ensure that he has a good airway. You should also ensure that the nose and the mouth of the baby is visible, that the chest to chest contact of the baby and the mother should be there. Baby's back should be covered for giving the warmth, and try and see that the mother is slightly in the semi upright position. And this supervision, if you are in a government hospital where you may not have a single person doing, but you can make policies where either the grandmother or the mother or the mother of the mother, or even the partner, or there is a supervision by an alert adult should be done, because you cannot allow this SUPC, which is a disadvantage. And remember, the sudden unexpected postnatal collapse can occur in term babies who are breathing well, though the percentage is very less. So this was only a word of caution that we should all know how we are doing the skin to skin contact, because we definitely have to do the skin to skin contact to get the maximum advantages of increase in breastfeeding. It will reduce the newborn stress, crying, regulates the baby's temperature, etc., etc., all that you have covered. So this was only one carry home message for the audience that is here. We need to be aware of SUPC. Thank you very much, Aarti. We'll go ahead with the next
Thank
talk.
you, ma'am. Thank you, sir.
Thank you. Till now, we are going, keeping with the time also and enjoying the academic feast also. Ma'am, today morning I had session with the ASHA workers and had very interesting input from them. They said that they asked the mothers, rural mothers, to wear saris instead of gown, so that they should have a stomach to stomach contact with the mother. How truthful it is, I want to know from you.
Yeah, so it is. If they wear a sari, the blouses are always, by and large, 99% of blouses that our mothers wear are front open. So it's very easy for them to give the skin to skin contact. And I think that's the best thing. Of course, a sari may become a very cumbersome thing when they are delivering. A petticoat is good enough, and the sari can later be worn. That's what I feel.
Oh.
Dr. Prabhu, if you want to add anything.
And I agree with you. We have always said that, means Prashant always tells that the husband's shirt is the best thing which the mother can wear
Yes.
at the time of delivery, because it's a
Yes.
front opening shirt. And
Correct.
gowns are the worst because
Yeah.
it is so difficult to
So
breastfeed
difficult.
when you are wearing a gown. So please don't advise anybody's a gown. And nowadays you have zipper grounds where I don't know how a mother can feed by just pulling down the zipper
The
and
zipper.
baby.
Yes.
So
And there is no,
yeah,
remember these zippers are on both the sides and they open up only for the breast, you know.
yes, yes,
There's no skin to skin contact. So अपना जो Indian cheese है ना, let's not copy
yes,
what is
yes.
outside,
We
you
should
know.
not copy. And saris
Exactly.
are really good, but not in the
They are
labor
very,
ward, as madam said.
not in the
Afterwards.
labor ward. So in the labor ward, it will be the blouse that she is wearing and the
And a
petticoat
front
which she,
opening shirt, which can be easily
yes,
opened.
yes.
Thank you, sir. And our next speaker is Dr. Rujuta Parikh. She is consultant at HN Hospital, Mumbai, as well as she is lactation consultant at Saifi Hospital. And she is trained in child and adolescent mental health programs at NIMHAS. So she has complete panorama of looking after pediatric newborn to adolescents. So Dr. Rujuta, please carry on.
Very good evening to all the dignitaries and regards to my colleagues. Thank you for having me here, and it's wonderful to be here also with Prabhu sir, who's been my mentor, guide, and whom I've worked very closely with the UNICEF Center. I'll share my. So my topic. My topic for today is breastfeeding, positioning, and attachment. So when we talk about positioning and attachment, I always say that, the mother's the first dining table of the child, the breast being the plate, and the newborn or the child being the subject who's going to come to eat the food. So, why not prepare the dining table well? Latch generally is never the problem, but the positioning or preparation of the dining table is the problem. And if the position is correct, the latch is very easily established. So looking at what positions the mother should be sitting, the mother should sit comfortably with the back well supported. Breast holding should be in a C shape or a U shape so that a sufficient amount of breast is held by the mother and there is less compression of the milk ducts compared to a lot of mothers holding the breast in a scissor hold. Hence, it's always better for a C shape hold. Also, the nipple should be touching to the baby's upper lip, and as soon as the baby opens the mouth, bring baby closer for the latch. The mother should always be interacting with the baby while feeding. Like Shushma ma'am said in the middle, how should be the position of the baby? The baby should be turned towards the mother, held in a straight line with skin to skin contact, and the baby's neck and shoulders should be supported. So the mouth wide open, that's how the baby should be, and the mouth should be wide open, lower lip is turned outside. This is what we've seen in our textbooks also. Chin touching the breast, the black part of the breast not visible below the lower lip. Large black portion of the breast and nipple, including the milk collecting ducts, are inside the baby's mouth. And the tongue under the teeth. Now, why some specifications and why is it important to have these specifications? So the mouth wide open, so that a mouthful of the breast could be taken in the by the baby. Why maximum possible areola or a mouthful of breast and not the entire areola? Because each mother has a different areolar size, so it's not always possible for the entire areola to be inside the baby's mouth. Why the lower portion of the areola? So that the baby suckles the milk with the tongue and the tongue is placed inferiorly. This will facilitate the tongue to get a larger grip for effective sucking, and the nipple is directed to the palate and not towards the throat. Why the lower lip turned outward? Because of course the lip, if it's turned inward, it becomes as a barrier, and during the feeding baby suckles with the tongue. Why the chin touching the breast? So that the nares or the nostrils are a little away and open. uh, the touch of the nipples to the upper lip and not the lower one, because stimulating the upper lip helps the baby to grip larger portion of the lower areola, and that is what is desirable. Also know that the odor of the nipple and the milk also stimulates the baby to open the mouth widely. Just like we go to the restaurant or we have the food in our plates, we smell the food and then we eat the food. Exactly like that happens with the baby here. Coming to that, once the positions are sorted and the baby's well positioned, the feeding reflexes are established. That's the rooting reflex. When something touches the lip, the baby opens the mouth, puts the tongue down and forward. That's where we see the rooting reflex, followed by a sucking reflex when something touches the palate and the baby sucks, followed by a swallowing reflex when the baby fills the mouth with the milk and the baby swallows the milk. And then there's a gag reflex. When something touches the anterior part of the tongue, the baby pushes it out. So these are the feeding reflex that are established. These are the 5 effective steps and stages of latching. The first picture, you can see that the nipple is just placed on the upper lip. The baby is then slightly opening the mouth and the full mouth when it's open. And then the baby is latched or snugly pulled towards the mother. Also know that if it's an ineffective latch or the baby is moving or something, please re-establish the latch so that the baby is not, or the mother's not injured. Delatching, a lot of times because the baby is not trained, so the baby sleeps in between, baby gets discomforted in between. There's a lot of discomfort maybe in the initial days, which is where the mother should learn the delatching. She just needs to put her last finger in the corner or the angle of the baby's mouth, which is where the suction is broken, and the moment the suction is broken, the baby's mouth is pulled out. This helps to not injure the mother. There's no nipple trauma, injury, cuts, or burns over the nipple. Constant inappropriate delatching will lead to redness, soreness, and burns and cuts. Hence, a delatching with a proper method is always important. Which position of the baby should we hold the baby and why? So the best position is the one where the baby feels seen, held, and safe, and not just fed. Our simple positions coming to just when the baby is delivered, the laid back position or the biological nursing, where the mother reclines comfortably and the baby lies prone on the chest, which is tummy to mummy position. It's best for the newborns, overactive let down, encouraging self latching, and for fussy babies. And a clinical tip is this is the position which is used in the first hour of the life. A cross cradle position, a mother and the baby, so opposite hand and opposite breast is a cross cradle position. It's best for newborns learning to latch, premature hypotonic babies, and ICU graduates needing a controlled latch. And so wherever a control and adjusting of the mother is required, a cross cradle is always better. So in our teaching time, it's first always better to teach the mother a cross cradle position. Coming next is the cradle position, which is the traditional hold with the baby lying on the same side as the feeding breast. And it's best for an established latch for older babies and for more confident mothers. It's harder for newborns, so avoid as a first line of action, and may worsen shallow latch if not corrected. Football or a rugby hold is where the baby is tucked under the arm like a football, just like you can see in the picture. The mother supports baby's back and neck, and it's best for C-section, for tandem nursing, where 2 babies are to be fed simultaneously, for large and pendulous breasts and babies with a weak suck. This is excellent for controlling the head and achieving a deeper latch. The sideline position that we see is best for night feeds, co-sleeping setups, maternal exhaustion or post-op rest, perineal pain or stitches, babies who fall asleep quickly at the breast. And a safe sleep environment is very, very important here. We all know about safety of babies while sleeping and breastfeeding. So that is something that we should always be taking care of. Straddle or a koala hold is where the baby sits upright astride the mother's thigh or lap, head aligned over the breast. It's best for a GERD or a reflux or a laryngomalacia, older infants with a stronger neck control, maybe a 2-month or 3-month, a cleft lip and a palate, so that the seal becomes very easier here. And it's a complete seal which has happened, which allows not the air but a real effective amount of breast milk to go inside the baby's mouth, and in ear infections. So gravity helps reduce the choking, gagging, and high flow let down. Few others that you see here. The first one is a dancer hold that you see and is generally used in a Down syndrome. 2 fingers, that's the thumb and the first finger on the cheek, and the 3 fingers rest on the breast. That's the dancer hold. Then a clock duck, some dangle feeding, and the last one is a baby wearing feeding. Know that breastfeeding and position is always an art and not a very stringent process. So, once you keep modifying as per the needs of the mother and the child, it's always better, because that should be a very comfortable environment. Clinical application it's just a summary. Premature low tone, cross cradle, laid back, or a football position. A cleft lip palate can have a koala upright football. A reflux laryngomalacia, as we saw, again a straddle, side lying upright. A tongue tie shallow latch with a football cross cradle and a laid back. Nasal blockage URI with upright football. A poor weight gain with a cross cradle, and multiple births with a double football that we saw in the picture. So to conclude with, a newborn has only three demands, and these are the warmth in the mother, in the arms of its mother, the food from her breast, and the security in the knowledge of her presence. And breastfeeding satisfies all three of them. So why not breastfeed each child which comes to us? Thank you.
Thank you very much, Rujuta. Ma'am, Malik ma'am, your insight words.
Thank you, Rujita. That was very well covered. I just wanted to ask, you used twice the word burns. So where are the burns, you know?
So not technically. So generally what happens when the child keeps biting the nipple or if it comes, the
Okay, you
mother has a
mean the
lot of
burning
pain.
sensation.
The burning sensation. The burning
Okay,
sensation.
so
Yes.
I think you
Sorry.
should clarify that and not
Yeah,
just say
yes, ma'am.
burns. That was one thing.
Yeah.
Tell me now, these days there's a lot of studies saying that the crossed cradle position is the better one than the normal cradle that we were using. And have you read more about it? And do you know the advantages? Because there is a strong lobbying going around for cross cradle position hold.
Correct. So as much as I'm aware about, ma'am, in my practice and wherever I've tried, with cradle, yes, once it's an established, so every mother wants to do a cradle because it's been coming and going on for generations, and everybody teaches the cradle position in the family first, or they just tell the mother to hold the baby. However, when it comes to a cross cradle, the back becomes very easily upright and straight. The neck is held well. So I think a cross cradle is working better in an initial day, and she also has less amount of injuries or feeding problems in a cross cradle, and she gets back to latching very easily rather than a cradle, at least in the cases I've taught. So I'm actually not doing cradle much.
I will wait for Sanjay Prabhu to enlighten more on this if he can, because we've always used traditionally the cradle position. But nowadays there's a lot of talk on cross cradle, and I have seen many of the babies, they gain better weight. So I will ask Dr. Prabhu to say if he has in his experience more of this.
I always maintain that the mother and child decide which is the best position for them. So there is no absolute guideline that this much amount of weight gain has to occur in a baby. It's always a range. Now, if you look at WHO or UNICEF guidelines, also they say the first 3 months you have a very good weight gain, 150 to 200 gram per week for the first 3 months, and then it drops down to 100 to 150 gram per week for the next 3 months. So, if the weight gain is occurring well, if the child is happy, mother is happy, I don't even ask the mother to show me how to feed. But if the mother comes with an issue that if she tells me that I am not the baby is not feeding well, and I am looking it objectively that the weight gain is suffering, the baby is not passing adequate urine, I will ask the mother to feed in front of me. So there is no point in just telling these points in visual. You have to visually see how the mother is feeding. It takes time. It may take half an hour for the mother to actually try and feed. And remember that as a counselor, we have to not make any negative comments. Whatever said and done, mother is trying to breastfeed. That is the best thing which is occurring. And she has come to you for help. So you have to maybe change 2 or 3 things which are disturbing the child the most. Don't go and say that I've learned 4 points in baby's position, 4 points in mother's position, and 4 points in position and attachment. All 12 have to be there. No. What is disturbing the baby more? What is disturbing the mother more? Please look towards that. And then tell her that, okay, you are doing very well, but why not try this way? And you will be surprised to know that in any sort of position also babies have grown so well. So yes, I agree with Rujuta that maybe cross cradle is good when you start off, but then the baby and the mother decide what is the best position for them. And if they are happy, mother is happy, baby is happy, I don't interfere.
Yeah. Thank you. Thank you very much. Yes, Suchita, over
Yes.
to you.
Yes. Thank you, sir and ma'am. And our next speaker is Dr. Sharvari Rathi, a private practitioner and breastfeeding consultant at Dhantoli, Nagpur, as well as consultant at ESIS Hospital and a social media influencer also. She has whooping 8,000 followers on the social media in lactation promotion on FB and Insta. Dr. Sharvari, please.
Hello, ma'am. Hello, everyone. And it's such a nice thing to see all of you gathered here. Happy Breastfeeding Week, everyone. And I wish this Breastfeeding Week becomes an year. And every time everyone is talking about this thing. So, yeah, this was a last minute thing for me. I am, instead of Dr. Surbhi, I am here today to present the talk. So, yes, sharing the screen. So yes, my topic is, I hope everyone is able to see it.
Yes.
Yes.
Yeah. Okay. So my topic is early breastfeeding and breast and nipple problems. So yes, mom in the early, like if they are not antenatally counseled, if they are just given a baby after delivery. So many of these mothers would face the issue of how to breastfeed, how to hold the baby, what to do now. So yeah, there are common issues, and the most common thing which is causing all these problems is latching issues, latching and positioning issues. So most of these nipple and breast problems, they can be addressed by just one simple thing, by explaining them how to latch, how to position the baby correctly, and these challenges can impact maternal journey of breastfeeding. Most of the mothers, they become so scared because of the nipple pain they face that they just want to leave breastfeeding. They are demotivated. So just one work we have to do is to make them correctly latch. During counseling, only 50% of the pain reduces if you make them latch properly. Okay. So yes, and the infant health is also impacted if the mother is demotivated. So we will go one by one. Nipple problems. Most common thing which we face is sore or cracked nipples. Yes, caused by improper latching and attachment of the baby to the breast. And mother will be experiencing very much like throbbing, pain, tenderness, redness. There can be fissures, they can be cracked. The bleeding nipples can be there. Most of them can be also because of the improper delatching technique. She'll just pull away when she finishes her breastfeeding. Now, here, your job, like if she comes to you or if you're visiting her after delivery, just ensure she is having a correct latch and positioning. You can apply purified lanolin creams, give rest to the nipple, rest to the breast, give express breast milk, air dry the nipples, and of course, everyone should get a lactation counseling after delivery, because most of these mothers, they are so much unaware, they get wrong counseling done at hospitals, and most of the doctors won't have that much time to visit the mothers to explain them about the latching and positioning techniques. So you can see in the earlier presentation which we saw, how a latch and positioning can help a mom and also can prevent cracked nipples, nipple pain, and she will be more motivated and happy if this just small technique you explain her. Most of the moms, they have flat and inverted nipples, which they know even in the antenatal course. So just identifying these problems in the earlier months and explain them that you may have some difficulties while latching, but always remember that it is breastfeeding and it is not nipple feeding. So get a good latch and positioning, and a baby is such a thing that they can adapt to any type of learning technique. If you give them a bottle, they can have bottle. If you give them a nipple sheet, they can feed on nipple sheet. If you give them a flat or inverted nipple, they can properly latch on it if with practice. It's not possible. You can use nipple sheet, but nipple sheets are not a long-term thing to be used. Otherwise, baby gets like baby will be more preferring nipple sheets. A milk bleb. A milk bleb is just a white dot. It can be a clear or a yellow colored dot. It is present over the surface of the nipple. Now, it is very painful while nursing. So, it has been found that blebs are not, initially it was confused with thrush, but now it has been found that it is because of the inflammation in your milk ducts. Causes are unclear still. Some say that it is because of the latching problems, but it is not necessary that milk blebs are always because of latching issues. Now there are some lecithin supplements which you can give if the mothers is regularly facing this issue because of the lecithin deficiencies. Anti-inflammatory drugs, you should advise mom that you should not prick that nipple bleb. And hot wet compresses that can be relieving to the moms. You can use Epsom salt in lukewarm water or hot water, and that water soaked with a cloth can be applied on the nipple blebs so that the mother will be relieved of the pain. Then there is nipple vasospasm or Raynaud's phenomena. It is a very rare finding, like very much like most of the moms, they don't have this issue. But it is, if you have that, you have to just observe the color of your nipple. After feeding, if it changes color from white to purple to again it becomes normal, then it might be a nipple vasospasm. It is because of the vasoconstriction of vessels. It causes intense pain for the mother. It's burning and throbbing, and they are unable to continue breastfeeding. So yes, it is because of the exposure of the nipples in cold, or if they are more air dried or more exposed to cold, they have this issue more. So keep your nipples warm. Also, magnesium supplements or essential fatty acids or fish oils can be given for the relaxing of the blood vessels. Now, nipple dermatitis. Now, these dermatitis of the nipple and areola area can be caused by ointments and creams which you're using on the nipple. So, detergents you use to wash your breast pads, undergarments. You are using some harsh soaps, sensitivity to soaps or shampoos, or reaction to the fabric of your bra or bra pads. Now, some breast problems. Low milk supply is a very big problem for most of the moms. They're confused whether they are having a low milk supply or not, whether their baby is feeding or not. So I would add this as I would say this is the number one issue, number one breast problem which many moms are facing. They think that their milk is not enough for the baby. So just ask.
Dr. Sharwari, you are not audible.
I think she's
Yeah,
having network issues. She's not
I
audible. She's
think
frozen also on screen.
you can ask her to switch off her video and then some bandwidth comes in.
Yes, madam.
Mm.
She has left also from that device.
She's lost contact with the.
Yes.
I spoke to her. She's trying to reconnect.
Okay, we'll wait then.
We
We
just
have
wait
to
for a minute or so. She's trying. I
Yeah.
told her to switch off her camera and reconnect.
Okay.
Can we have some expert comments, Amol sir, in the meanwhile on nipple problems with our experts? Sushma madam, Prabhu sir.
Yeah, so actually, I know it was quite a theoretical talk. To finish it in 10 minutes is a challenge, actually. And I think last minute she's been told to do it. But she's doing well. She's told us the basics, and she was still enumerating more towards the nipple problems. She has yet to reach on to the breast problems. So we do come across these common nipple and breast problems, especially in the primary mothers and in mothers who are not supported well, or they don't have relatives who can even guide them. So one has to ensure
Hello.
that, yeah, I think she's come back.
Yes, ma'am. Just I have joined with the mobile.
Yes.
My presentation,
Okay.
I'll read it from my laptop, okay? So sorry for
Okay.
the issue, I guess. Suddenly the Wi-Fi has gone off. So
Okay, no
I'll just,
worries. Just
okay.
remain relaxed and
Yes.
you can continue
Yeah,
your
yeah,
talk.
ma'am.
Yes,
Yeah.
please.
So we were discussing about the
Can you,
low milk supply.
is it possible for you to share the presentation with Amol? Or is Amol having, Dr. Amol, are you having her
No,
presentation?
no.
Then
I
she
don't
can
have.
just,
Sir, I had sent you on your personal number.
Okay, 1 minute.
You can share the actually, I have added a more things after that also. So I wouldn't wanted to
Can you
share
share
that.
the new one, latest one,
Yes, sir.
in group directly?
or wherever, if she finds your number
Yeah, yeah.
first, wherever.
Personal number
Meanwhile,
also. Yes.
yeah, till you are setting up Amol, maybe she can still keep
Yes.
speaking
Yes, sir.
in want of time being saved,
Okay.
But please share and then start
Sir,
talking.
sir, then otherwise you can start with another person talk. I will share my talk if it's
No,
fine.
you just have to forward because you are in the midway.
Okay, okay. Okay.
Take
Sir,
a
can you share your email address? I would like to.
Yeah. Amol Pawar 98 AMOLPAWAR 98 at the rate jdipmail at the rate gmail.com.
So yes, we were discussing about the low milk supply, and moms are facing this issue most commonly. Then there is another issue which we face a lot, that is after delivery, the engorgement issue, which is on the day 2 or day 3 after delivery. In engorgement, mother will be having tense, swollen breast. They are more of, mother is also feverish. Sir, on this number, I have shared you the presentation. You can just play with that. Play the presentation. I have shared you
Email.
in WhatsApp. On WhatsApp, I have shared you. You
Not
can start.
not received.
Sir, on this number where you have sent me.
Okay.
Okay, Ari.
Yeah. So mother notices that her breasts are swollen, hard and painful. Her milk has come in, but the fullness is causing her distress and fever. Solutions for this is frequent or early breastfeeding. We also have a reverse pressure softening technique. Okay, yes.
I got it at 750, but that was old, you told.
Yes sir, it's fine. अभी के लिए सर आप प्ले कर दीजिए.
वो 750 वाला. Yes.
हाँ, yes sir. Breast problems पे sir.
So yes, frequent or early breastfeeding is very much helpful. Early initiation of breastfeeding can reduce this engorgement issues. Warm compresses, breast massage can help. You can have a flat hand breast massage or a knuckle breast massage so that the milk can flow to the nipple and it is easier for the baby to have breastfeed. Now there is a reverse pressure softening technique which we use when there is a issue because of the engorgement. The nipple gets inside the breast and it is difficult for the baby to latch during engorgement. So here what we do is we will apply pressure around the nipple, and because of the edema which is there, it gets removed and the nipple comes out and the baby is able to breastfeed. So this can be gentle breast massages, warm compresses, and frequent breastfeeding. This can
Sorry to
relieve
disturb you.
Yeah.
Presentation is visible. Kindly let me know which slide I should.
Ma'am, just the next slide. Next second slide.
Is it okay?
Yes.
Is it correct, ma'am?
Yes. Thank you, ma'am. Thank you. There was a picture for reverse pressure softening. So you have to apply the pressure over the areolar area to relieve the edema, and the nipple comes out and there is easy for the baby to latch on the breast. Next slides. Plugged or blocked milk ducts. Now, these are nothing but milk ducts. Sometimes a particular milk duct gets blocked, and this causes swelling of that area, breast area. There is tenderness and there is inflammation. Now, this is because of the incomplete drainage or infrequent feeds, or there is a particular position because of which a particular area of that breast is not draining milk. Lecithin deficiency in rare cases. Now here again, you have to particular area of that breastfeeding, like we saw earlier, a clogged duct positioning of breastfeeding, dangling position, so that particular area of that breast area is drained for feeding. And gentle massage of that area, flat hand or a knuckle massage. Apply warmth before feeding or try different positions. Mastitis is, next slide. Mastitis is inflammation of the breast, often with infection, causing pain, redness, swelling, warmth in the breast, flu-like symptoms. Causes unresolved plug ducts, bacteria entering to the cracked nipples. Now here you can manage it with you can manage, like you can continue breastfeeding. It's not like you cannot breastfeed your baby. So you have to counsel your mothers like that. And antibiotics, pain relief, rest and hydration for the mother. Breast abscess. So collection of the pus in the breast. Next. Are often a complication of untreated mastitis. If this mastitis continues for a long time and it goes unnoticed, you can have a pus in your breast. Mothers will say that they were having high-grade rigors, fever, and it is a painful condition. There is a swollen lump, often accompanied by fever and redness. Again, antibiotics, drainage or incision and drainage will be required, and a medical attention. Medical professionals have to intervene in this case. We have shown in this slide, there are three pics. First is of engorgement, second is of mastitis, and the third one is there's an impending breast abscess which is there, which you can see. So you can see the difference. In engorgement, mother will be feverish, but high grade fever will be seen in mastitis and abscess. Next is breast and nipple thrush. Here, there is fungal infection of the nipples and the breast. This is also severe burn. This also causes severe burning pain in the nipples and the breast, often persisting after feeds. Nipple may appear shiny, flaky, or bright pink. Here, antifungal medications for both mother and the baby are given so that the infection is not transferable. And there good hygiene, keep the nipples dry, avoid using moist breast pads, keep your clothes clean. Hygiene is very important. The next, impact of tongue tie. Now, tongue tie is a baby's condition, but this if can cause damage to your mother's nipple, and this can also cause poor breast milk intake, decrease in milk supply over time. So this condition is having an impact on breast and nipple conditions. So this will interfere with your baby's ability to latch. It's nothing but a membrane which is which is there between the tongue and the mandible area. Now, general tips for prevention and management. Ensure proper latch and positioning. Seek guidance from a lactation consultant. Frequent and effective milk removal. Breastfeed or express milk regularly. Maintain good breast and nipple hygiene. Wash with water. Avoid harsh soaps. Keep nipples dry. Wear a supportive, well-fitting bra. Rest and stay hydrated. Support your overall well-being. Now, when to seek professional help? If it's intensely painful, not working with your home remedies, and there's nipple discharge, there is a lump or abscess which you can see, and there are high-grade fever, rigors, and signs of infection. Thank you.
Thank you, Sharwari. You came as a night watchman, but scored so well.
I hope so. Thank you.
Very good. Excellent. I think excellent, given the time limit and you have covered, though one could have gone more in details, but it's really not a topic to be taken just now in details. Thank you for enumerating all the common nipple and breast problems. The answer to all the problems that occur and how to treat them is very simple. And first and foremost, it is prevention. And for prevention, you need the previous lesson that was taken on position and latching. I think once when there is good positioning and good latching, it will sort out all these forthcoming problems. And this cascade of whether having sore nipples, cracked nipples, then you go on to more of problems. There's engorgement, and it leads to more of fullness, then leads to mastitis. Further, if you don't treat it, that whole cascade starts developing. And therefore, the answer to all this is good positioning and latching and exclusive breastfeeding, I think will sort out all on this. That's my short comment for such a talk. Yes, Prabhu sir.
Just two things I just want to stress here. One is that the most important technique which every mother should know is expression of milk.
Yes.
So this cannot be stressed, and it has to be stressed at every meeting that expression of milk is an art. It is not that you just tell them, you just squeeze the breast and the milk will come out. It's an art which has to be taught to every mother, especially the mothers who are feeling either fullness of the breast or engorgement. We need not let the breast go into a mastitis or a breast abscess phase. That means your counseling has not worked. And this has to be done during the early days. So whenever you are taking the round in the postnatal ward, one of the questions which is always asked is to the mother is that, are your breasts feeling heavy, or are you feeling warm, or are you running any temperature? That is one of the ways to judge whether the mother has started engorging, and that is the time when the expression has to start. And the other point which I wanted to bring out is, now in a breast abscess, we don't do INDs. We have stopped doing them. We do a ultrasonographically assessing the abscess and aspirating. So repeated aspiration under sonography control is the best method, because an incision and drainage will always cut the ducts. So whenever you cut the ducts, the feeding through that breast totally ceases. And this is not only for that baby, the baby who is going to come next maybe also will have the same problem. And the mother always gets that negative emotion that it is because of my breastfeeding that this abscess became. So this breast milk has something to do with that. So maybe that I will not breastfeed my next pregnancy. So it's very difficult for us afterwards to counsel these mothers that it was not the breast milk which caused the abscess, but the poor attachment or poor positioning which was there. So these are some few points which I wanted to highlight. Thank you.
Thank you, sir. So practical points to follow. And our last batsman is and all-rounder is Dr. Sulabha Pawar. She is a practicing pediatrician and consultant at Anurag Safalya Hospital at Nashik and Sai Bal Rugnalaya Satana, and is faculty at various conferences. And she is a dynamic pillar of strength to support our dynamic secretary, Dr. Sulabha.
Yes, ma'am. Good evening, all. I would like to say thank initially to Maha IP to give me this platform for sharing my views about the breastfeeding. Now I am sharing my screen here. The screen is visible to all?
Yes, ma'am. It is full screen also. Thank you.
Yeah. So prioritizing and supporting breastfeeding in the working mothers. As we see the picture here, the mother is working while she's cooking, she's working, doing office work. She's holding her baby in one hand, she's talking on the phone also. So when we say we have to prioritize the breastfeeding in working mothers, why we say so? Because just a minute.
Ma'am, click on the presentation and then
Yeah. Just a minute. My slide is not moving actually. Yes.
Ma'am, first click on the slide and then click for the move ahead.
Click on the slide and click on the move ahead. Just a minute.
Click on the arrow key, ma'am.
Yeah, yes, a minute. Yes. So today's my presentation is having following contents. We are having introduction of the topic first. What are the hurdles in the breastfeeding in the working mothers? Employment, how it affects the breastfeeding initiation, exclusivity, and the duration. Occupational hazards in the workplace in the relation to breastfeeding. Benefits of the breastfeeding to the employers, mothers, infants, and community. Basic workplace requirements to support the lactating mothers. Express breast milk storage and its use. What is the Maternity Benefit Act in India? And components of the successful lactating support program. Here, if we see, working women in India are around 37% in 2023, as compared before 2000, it was only 30%. This is calculated as the female labor force participation rate. The percentage of exclusive breastfeeding globally is 48%, but in India is 67%. And exclusive breastfeeding for 6 months in the working mothers is only 15.9%. So what are the hurdles in the breastfeeding in working mothers? Weak family support system, workplace environment, social and personal factors, limited maternity leave benefits, lack of community support, lack of government policies for the working mothers. So, the immediate support system for the mother in the family is the baby's father and the grandparents in the family. If they are encouraging the mother for continuing exclusive breastfeeding while working, that will be a great opportunity for mother and the baby as well. At the workplace situation should be having the few things like the one place for the mother to sit and feed the baby, to express the milk, as well as to store the milk there, and the employees as well as the boss or the employer should be having the known policies about the breastfeeding and how to express the breast milk at the working environment also. What are the social and personal factors? In the personal factors, I would like to tell you the mother is already exhausted with the breastfeeding for 24 hours, with working at home, seeing her health as well as the others' health, as well as the household chores also she is managing. So, if the society and the family support system is not working well for her, then her personal factors will get a more rise about it. The limited maternity leave benefits also affects the breastfeeding woman to continue exclusive breastfeeding. Lack of community support. If the community as well as the government policies are not supporting the exclusive breastfeeding in working mothers, it will be difficult to get the baby exclusive breastfeed for 6 months. So employment affects the breastfeeding initiation, exclusivity, duration, and rate of initiation of breastfeeding. So rate of initiation of the breastfeeding in the working woman is around 95% in the first few days. But as the time goes on, exclusive breastfeeding up to 6 months in these working women falls down to 15 to 20% globally. It all depends on the type of occupation, whether she is professional or the low wage job, having low wage jobs, number of working hours for the mother, socio-cultural factors, economic factors, healthcare practices, and the government policies and its implementation at the workplace. So, if the mother is highly professional, well educated, well known, and well trained for the breastfeeding, she will be continuing it exclusively. So, the mother is having low wage job or she is not trained well for the breastfeeding even after the delivery and working hours in the working hours, and as well as if she is not getting the proper leaves, then it is difficult for her to continue exclusive breastfeeding. What are the occupational hazards in the workplace in relation to the breastfeeding? It is prudent for pregnant and lactating women to avoid the exposure to the radiation, hazardous chemicals, volatile organics, and smoke. Protective clothing, masks, goggles, and air filters are the strategies for pregnant and lactating women working around these toxic chemicals. Women may also be exposed to harmful substances while working in the home, agricultural field, and healthcare sector as well. Women working in the welding area, painting, ceramic industry, and handling the weapons must be aware of the lead exposure for her as well as the baby. So, wherever the mothers are working, they should be well aware about all these factors as well. What are the benefits of breastfeeding for the employers at the workplace, for the mothers, infants, and the community? For the mothers and the babies, continuing breastfeeding at workplace results in the optimal outcome in baby's health, growth, development, and therefore there can be significantly reducing numbers of acute and chronic infections in the babies. Emotional bonding with the baby will be good for the mother. And as the baby and mother both are healthy and happy, there will be low healthcare cost with fewer missed days of work as the baby is healthy. So, saving the energy, time, and cost to purchase, store, and repair the infant formula also goes hand in hand. For the employers, support for breastfeeding results in fewer employee absences due to which need for taking care of the sick babies, lower cost of the employers who provide the healthcare sector for the mother, then improved employees' loyalty to the company, and therefore there should be reduced turnover and there should be reduced dismissals from the job also. Higher job satisfaction can be there for all the employers as well as the mother who is working there, and the community recognition of that company can be as a family friendly business. For the community, workplace support for the breastfeeding results in the longer duration of breastfeeding with accompanying health and economic benefits for the mother, baby, as well as the community and country. What are the basic workplace requirements to support the breastfeeding for the lactating mothers? A nursing space for the mother at the workplace, like Hirkani Kaksha, what the Maharashtra now decides. It includes a proper separate room for mothers for breastfeeding as well as expressing the milk, availability of the breast pump there, maybe hospital grade, then creche for the baby if possible, refrigerator for storing the expressed breast milk, and the necessary furniture in the nursing room. As well as this nursing room, please make note of these things that this nursing room or the baby feeding room or the baby milk expression room should not be replaced with the bathrooms as they are not hygienic at all. So, how the express breast milk can be stored and used? Breast milk storage guidelines tells us that the freshly expressed or the pumped breast milk can be stored in the room temperature up to 4 hours. It can be stored in the refrigerator with 4 degrees centigrade temperature up to 4 days, and deep freezer minus 18 degrees centigrade or cooler can keep it fresh for up to 6 months or up to 12 months also. So when we use this stored milk or the express milk, how we have to use it? We have to thaw it and take it to the room temperature and then we can use it. So how the previously thawed and previously frozen milk is good for them babies is for 1 to 2 hours when it is kept in the room temperature. When it is kept in the refrigerator, this is good for 1 day, and when it is in the deep freezer, it is safe to use for 1 to 2 days, but it should not be again refreezed for using it again. And whatever leftover of the milk express milk for the baby, it should be used within 2 hours after baby is finished the feeding. So, what is Maternity Benefit Act or amendment? Maternity Benefit Act in India has started from 1961, but the very important amendments has been made in 2017. Here, the maternity leave for the first two children was increased from 12 weeks to 26 weeks. Then 12 weeks maternity leave can be given for the children beyond first two children, and for 12 weeks maternity leave can be given to the mothers who are adopting a baby who is less than 3 months. This act also makes it mandatory for employers in establishment with 30 women or the 50 employees, whichever is less, to provide creche facilities either in office or in a place nearby within 500 meters. So the working mother will be permitted to make 4 visits during the busy schedule of working hours also to the creche either to breastfeed or to express the milk. And the employer may permit a woman to work from home if it is possible to do so for the workplace. Early establishment, we have to make these benefits available from the time of appointment. So whenever an employee and employer, they should have a proper what we call it as the guidelines for the employer as well as the employee. So whenever they are joining any company, there should be a guidelines about the working mothers whether they can breastfeed the baby there or take the baby to the workplace and keep the baby in the creche, or they can express the milk there and get the milk back to home. As well as with this, they can give a scheduled time breaks for the mother or the they can decrease the working hours for the mother less than the regular workers. So, what are the components of successful lactation support program? As we have just seen, the space for the mother to breastfeed or to express milk, the room should be carrying, it is a good, big, hygienic room with having the breast pump, regular electricity supply over there, a proper working refrigerator with a storage capacity, and necessary furniture over there. The mother should have time to express the milk over there. At least 4 visits in a working day should be made for expressing the milk or feeding the baby. What is the education to be given? A standard information to be given about about the company lactation program to all the employees while they are taking the job over there. In this, they should have a proper guidelines and they should follow national law for this. And as well as there should be a support system from all other employers too. So while ending my talk, I would just want to tell you one thing here. Dhanesh, close झालं. Am I audible?
Yes, you're audible.
Yeah. Here, I just want to tell you one thing, very important thing, whether it is job, whether it is whether it is a society, whether it is a garden, or whether it is your journey, traveling. If you are able to breastfeed everywhere, anywhere, and anytime, it is the best thing in the world you can provide to your baby. Thank you so much.
Thank you, Sulabha. Malik ma'am, your comments.
Yeah, thank you, Sulba, for this talk. My question is a little tricky for you because what you have covered with the Maternity Act of 2017, it is for mothers who are in the formal sector.
Yeah.
Or those who are having organized, they are in some companies, multinationals, BMC, or in government hospitals and government sectors.
Yeah.
But what about 90% of mothers who are in the non-organized sector, and how are we going? They are also working mothers, whether they are labor as they work as laborers, they are at the construction site, they come, our maids are coming at home, how many of us are supporting them, whether they are other domestic workers, small scale industries. So remember, 90% of working lactating mothers are in the non-organized and the informal sector. But just to give you that government did think about these, and they are giving a very paltry amount. Paltry amount means absolutely a very
Incentive.
small incentive they are giving, but something is better than nothing, and that is the Pradhan Mantri Matru Vandana Yojana.
Yeah.
You must remember this. It is the Pradhan Mantri Matru Vandana Yojana, which gives rupees 5,000. I think it is giving either it
Yeah.
is a lump sum or it is giving monthly. So I think whenever we talk of working mothers, we need to talk of mothers who are in the non-organized sector. And let us start looking within ourselves. How many of us are helping our own maids, our chefs, our cooks, our other workers who are helping us, and what can we do for them? Otherwise, the lecture has been very good and you have covered many of the things. In short lectures, I know a large amount does get left out, but that is okay. You've tried your level best and it was very good.
Thank you
And
so much, ma'am.
there are code on social support also, which is coming up of 2020, which is also which is also supporting lactating mothers in the non-organized sector. Thank you very much, Sulba. Over to Dr. Prabhu.
Thank you, Sulba, for a very nice
Yes.
talk.
Thank you, sir.
Only thing that I always say that every mother is working. There is nothing like a mother who is not working. We should say mothers in employment. So that's a different word. So these mothers in employment, they require special support because they are working plus also they are in employment, because work is going on 24 hours a day in the house also. So we can't really call them non-working mothers.
Yeah.
And the second
Yes,
thing is that
absolutely.
even at home, you can express the milk. And if you have a fridge at home, you can keep the milk in the fridge. You can label the containers as per the expression time. And then these can be used the next day according to the time how they have been collected. So that is very important because sometimes the mother feels that what should I do when I get home? How I can take out the milk and keep for the next day? And also encourage night feeding, because night feeding also takes care of a large amount of milk which the mother requires to give to the baby. So these are the 3 points which I just wanted to mention. Otherwise, very nice talk. Thank you.
Thank you, sir. Sushma ma'am, I just want to clarify a few things. This 5,000 incentive is given to the mothers who are registering their pregnancy with the ASHA workers and with the government hospital institutes.
Yes.
And
Yes.
where they are delivering, if they are delivering in the government institute, then only they are taking this incentive. Second
Yes.
thing, our ASHA workers are doing a wonderful job. We are visiting the PSCs every 15 days for Manavikas camps. Over there, they are giving not only attention to the pregnant mothers, but they are giving attention to the PNCs also about the breastfeeding. And I'm very happy that I'm getting at least 1 or 2 babies and mothers with the breastfeeding problems when I go for the camps over there. Thank you, ma'am.
Sulba,
Okay,
one
that
thing you
is
have to
good.
remember that it is the urban areas which require more support than the rural areas.
Yeah.
The
Yeah.
rural areas are doing much, much better than our cities.
Yeah.
It's the urban areas where we are exposed to so much of media, so much of wrong information, and so much of now called as media influencers, which are taking the mothers away from breast milk.
Breast milk.
That's right. So we really need to support, all these mothers. And as Dr. Prabhu said, that it is more a problem in urban areas because all the construction is occurring here, or we are keeping three, maids who come and help us. So see the problems and there are smaller scale industries. Yes, in the villages, they are supported well. Thank you. And this Pradhan Mantri thing is only for one child. Remember that also. So these are only little eye washes. Forgive me by saying this for the government that these are a little eye wash that they are helping. But as I said, something is better than nothing.
Thank you, ma'am. Over to
Yeah,
you,
well,
Amrita and Sujata, ma'am.
Thank you, Dr. Sulba. I think that was an excellent talk and excellent talk by all the speakers and excellent suggestions and valuable insights given by our experts. Do we have any questions? In the chat box, I didn't find any questions. If anybody wants to ask any questions.
Yeah. Please unmute.
Hi, can I just ask him?
Yes, yes.
Yes, Neelam madam.
Okay, sorry, I had to go in between. I missed one talk because I had to go to another meeting of vaccines. I just wanted to say, what is the thoughts of the experts on use of breast pumps? I mean, if it is covered, I apologize, but I would like you to repeat because I was very surprised when a senior pediatrician wanted to talk on a media that, you should avoid breast pump and do it directly and all. So I will listen to what the experts have to say and then I'll give my view.
Thank you, Dr. Neelam, for asking this. Are you asking for breast pumps for only being used by the high end users, and are they using as for just collecting the milk when they go back to work? Is that your question?
Right. So there are two ways at looking at it. So
Yeah.
one is when you use a breast pump, why do we want to add up when they go back to work? I mean, using a breast pump, even in the first 6 months when you are supposed to do exclusive breastfeeding. So my question is very simple. What is the view of experts in using use of breast pumps by the mother? As simple as that. Not for donating. I'm not talking for donating it in
Donating.
a.
No. So the mothers, why they are using is they're building up their stack so that they can go back to work.
Can we mute the
Second is
other people, Amol, and only unmute V2?
Yes, yes.
Nirad Yatkar. Yeah.
Yeah, so the reason why mothers express, firstly, the pumps should never be used in the initial few days. You have to have a well-established breastfeeding going on, and the baby should be directly fed. That is the best thing. And if there are any nipple and breast problems, the second thing is that hand expression is good enough to collect milk and feed the baby. Now, the question of why are mothers using breast pumps is to build their own stack, and we have to give them all precautionary measures as to how to store them also. Normally, mothers would do it in the fourth, fifth month to build a stash so that when they go back, their relatives or the in-laws or whoever is at home can feed the baby. That is the opinion for the use of breast pumps in the home routinely. And the second place, as you said, that you're asking only for these mothers and not in human milk banks. That's the second place where we are using the human milk banks. Human milk, I mean the pumps where we are using.
Right. So, did you all ever do a survey where you asked about looking into breast pump versus the manually? Because as the other experts have said, that there are issues in the urban as compared to, and we should look at a perspective which could be individualized rather than keeping very, like rigid rules. There may
No,
be there may be some classes which would want to use a breast pump because they may not be available for some time. They want to do their part time, they want to go out. And we need to look at it in a very positive manner. It's not possible sometimes, mother beyond 3-4 months, if she wants to go out and she wants to do it,
yes, that
I
is
see no reason why it should not be done. Because some pediatricians talk pretty unhealthy about that. It is not possible always in the fourth month, especially for you to do it manually because it's like you need to take out 250
yes,
ml or 300. It's not easy to do
yes.
that. So
So the
that's why I wanted you all to talk about that.
basically the
Can I
breast
add over
pump is
here? Ma'am, can I
yes,
add over
yes,
here?
Zenal, please add.
Yeah, yeah. Hi, Dr. Neelam. So I completely understand what you're trying to portray, especially when we are in an urban setup, and the breast pumps are so easily available. So buying these gadgets is something like every mother feels that it is her right. And the kind of patients I cater to, they already have 2 or 3 pumps by the time I see them. So their decision is very conscious that we want to pump and feed the babies. And I personally feel that being a lactation professional and a pediatrician, we need to respect the decision of a lot of mothers. Maybe their priorities might be okay, I want to feed my baby, but I also want my other part of my life or my social life or professional life to be maintained. So I have a lot of mothers who run boutiques, who are air
Yeah.
hostess, who are celebrities, who are actresses, and they do that. And I personally feel that if they are maintaining with the guidelines, as Malik madam said, if they're taking care of the hygiene, as long as they are feeding the milk in the right way, avoiding bottle feeding and giving exclusive breastfeeding, I think it is fair enough to allow them to go ahead with their decision.
Absolutely.
But yes, we have to
Absolutely.
inform them
See,
about what is
obviously, when
right.
you pump it,
Yeah.
it's not going to be that she's going to do that 24 hours. She's going to do it directly, only then the milk production will be good. But
Yes.
when she
Yeah.
does it, she wants to make a stop, as you rightly said. And second, whatever some social life you rightly said. Third, not to use the bottle feeding was a wrong line you used. You wanted to say not to use a formula. Because
Yeah.
when they express it, 250
Yeah. I'm
ml,
sorry.
how do you
Yeah. Yeah.
expect them to
Yeah.
say?
So
Fair
what I
enough?
meant is not to cater, not to go ahead and
I've
take a
got you.
decision to give
So,
formula.
yeah.
Yes,
So,
ma'am.
the message I wanted to give is that we should not have rigid rules because you have a 1.4 billion population with so many, in different sectors. So, we try to say so that the poor and the rich and that gap is not there, but sometimes all of us, because I've seen pediatricians giving remarks like this, and I feel that is wrong remarks. I know we want to support and get into exclusive breastfeeding. So here, my message would be instead of going for a top feed when she's not there like a formula, I would then say using a pump and storing your milk would be a better option
That's
than for that. So that was my thing.
absolutely,
Done.
absolutely right, Dr. Neelam. You've hit the nail on the head.
Yeah,
And
yeah.
the message is very clear that we have to ensure, as far as possible, to give exclusive breastfeeding. And
That's the thing.
yes,
Yeah.
definitely
And
the
another
mothers
thing, I
who
was
can
just looking
afford.
at this data, Shushma ma'am and Prabhu sir.
Yeah.
I want you to say there are two reports I get between 2019 to 21. Sometimes I see it comes as 55, and sometimes I find in the net it comes at 60 something. But when it comes 60 plus, 63 or whatever, then it says 0 to 5. So, what is the latest according to you all, the Indian statistics?
The latest statistics are NFHS 5. What you are
Which
quoting,
is
it is from 0 to 6 months. It is 63% exclusive
no,
breastfeeding.
it says
Yeah.
5 months, sir, in that.
No,
0
no,
to
no.
5 is
It,
63,
but
and somewhere it says. So I'm just reading
they have
Google.
taken the data is from 0 to 6 months, and initiation is 41%. So that is very less.
That
So
is very
I don't think there is any confusion about that. Complementary feeding is very bad.
No, no, you
8%.
repeated, sir. So you are saying exclusive breastfeeding is what? 2019 to 21.
63%. 63%
63.
NFHS 5.
emphasis in it.
And we'll be
Okay, sir.
having the NFHS 6 data by the end of this year. So you'll have a better idea.
Please kindly share with me, Prabhuji.
It will come.
Thank
It
you.
will come. It will come.
Thank
It's
you.
not still come.
Yeah, I think I would just say it was a wonderful session. Heartiest
Neelamji, I just
congratulations to
want to say one
experts.
thing. One thing I want to say here. It's the mother's choice what she wants to do. Hand expression or pump. It is
Yeah,
left
I'm
to her.
glad.
We are
I'm
there
glad.
to guide them that these are the options available. Whichever option she is comfortable, we should go with it. There is nothing against pumps at any level.
Thank you so much for being there. Thank you. Bless you.
Thank you.
Thank
Thank
you.
you, Dr.
Thank you.
Neelam. Thank you,
Amol, you
everybody
can
from
take a group picture and have me in also.
Yeah, already taken, ma'am. Yes.
Okay.
So,
Thank
Dr.
you.
Akhilesh,
Sir, my
you
last
have
question.
some question. I think he has some question. Vivo.
I have also a question, sir.
Yeah.
What
Hi,
is the
sir.
effect of screen
Akhilesh,
reading
yes,
during
please.
breastfeeding?
Yes, there is one question. Actually, two questions are there.
Okay.
Might be
Go ahead.
correlated.
Okay.
First is I see a paradox that BF breastfeeding is an instinct. Still, we are required to celebrate breastfeeding week and educate the ladies. We uh, we don't think that we are not giving the mothers to environment proper environment, because even in jungle the dead sword is tangling over the mother deer or herbivorous animals. Still, they feed their babies properly. But in our scenario, we say that the ladies are working or they have problems. Second question is that we always target ladies to be trained like Sasuma or aunts for the breastfeeding. But we always forget about the father of the baby, who I think still may have some instinct for breastfeeding. Even though he is not actually breastfeeding the baby, what reflexes can we means encourage in him so that he can help the baby or mother to breastfeed?
Excellent question. I will answer from the reverse side, how parents or fathers and other family members,
Male
especially
partners.
fathers, male partners can help, and they can help in various ways. They can hold the baby, give skin to skin contact, do the other household chores which the mother has to do, because that all relieves the mother of the anxiety and she can breastfeed well. They can look after the baby at night. If she has express milk, they can feed the baby with the bondla. They can help out in numerous ways, and I think they play a very, very important role. We are never forgetting the male partners. We are never forgetting the other relatives of the family. We always encourage in our antenatal setups also that the male partners should attend. This is in short, I'm answering as we are running late in time. Dr. Prabhu, please, if you want to add for this particular question, anything?
No, no. I would say that now a most important thing which you should have mentioned also is kangaroo mother care. The father is one of the most
Fathers.
important persons in KMC. The mother
Yes,
is
I
unable
mentioned
to
on
give
skin to
KMC
skin
for a long
contact.
time.
Yeah.
The father takes over. So that skin to skin contact and the bonding between the father and the child also goes a long way in that emotional development of the child.
Yeah.
Sir, my questions to the expert audience is that what is the impact of screening during breastfeeding? Most new generation does not want to leave the mobile. They are in the fear of missing out. So what is the impact during breastfeeding and continuously watching the entertainment or anything or working?
That is very bad. Not only does the mobile and the instrument give radiation, but more important, the mother is, instead of engaging with the baby, she is engaged with the phone. She is not stimulating the baby. She is not looking at the baby. So these are very harmful things.
See,
That's
breastfeeding
in
is the
short.
only time when you are interacting with the child. Because the mother is usually busy with some other work when the time she is not breastfeeding. So at the time of breastfeeding also, if she is going to look at the screen, then where is the interaction?
Yes, sir.
The baby is on its
PNC ward,
own and the mother is on its own. So
in the
no
PNC
screen.
ward also.
WHO says that no screen till 2 years, and it is both for the mothers while breastfeeding and the baby also, because indirectly the baby is also seeing the screen at the same time.
And
And
yes.
mobiles are also
Okay.
very unhygienic tools.
Yes.
The most
Leave the
infected tools.
unhygienic. They have the radiations. That is very important. It has radiations, and one
If you
should
call
not,
Dr. Dalwai,
especially
he'll give you
when.
a 1 hour talk on that, screens and
Yeah.
autism.
Yes, we are producing more and more autistic children when we are using these gadgets.
No, they are called virtual autism. They are not giving direct autism. It's virtual autism.
Yeah, virtual. Yes. Okay. Any last question, I think? Any other? Okay, I'll go over and hand over to the organizers, Amol.
Yeah. So I'll be doing the vote of thanks.
Just a minute, Amol. I want to share one thing. When the mother is seeing more screen while feeding the baby, it affects directly as well as indirectly to the bonding between the mother and baby. And the studies are coming now that the babies are becoming more aggressive when mothers is using more screens.
That is true. That is true. Yes,
Does it
Amol.
for the milk supply also?
Yeah, obviously.
Hello.
Over to Dr. Amol. Amol, sir.
Yeah, I got a labor call and now I have to rush for that. So thank you, stalwart academicians, the teacher of teachers, Dr. Sanjay Prabhu sir, Dr. Sushma Malik ma'am, for sparing your valuable time for this. Actually, first, thank you for consenting to be there for Maha AP on this important day, celebrating the this breastfeeding week. This was a very important CME for us as a Maha AP, and you have chosen all the topics perfectly, and we have assigned all the topics to our young dynamic, all the ladies, female IAPNs from all zones of Maharashtra, and all the speakers. They have taken a lot of efforts in delivering the best science
I'll
possible.
just interrupt. All the speakers are IBCLCs, lactation consultants, and I think all of them got IBCLC through BPNI Maharashtra.
Yes, right, ma'am.
Yes,
Right, ma'am.
yes,
So,
Amol. We all are the students of Malik ma'am and Prabhu sir.
right. Thank you for sharing all the wonderful science to all the pediatricians and all PG students and all the IPNs across India. Actually, there was means more than 275 people have attended this session, and all the queries were answered. All the practical problems which all the general pediatricians are facing, they are answered very well by all the speakers through their presentation and all the experts also by one-to-one talk. So thank you, thank you all the attendees. Thank you both the moderators. Actually, already Neelam ma'am has. Thank you, Neelam ma'am and Vasant sir for sparing time for Maharashtra IIP, the biggest branch of India in terms of members and in terms of all the stalwart pediatricians, all the academicians across country. Maharashtra is giving uh, lot of contribution to Central IIP in terms of all the social activities as well as academic activities. So wonderful comparing by both the moderators, both the executive board members of Maharashtra IIP, Dr. Suchita Pokhle ma'am from the remotest branch, Dharashiv of sitting rightly near the Karnataka state, and the other one from Metro, the ever dynamic, ever enthusiastic, learned Dr. Amruta Shirodkar madam from Mumbai. And thank you, Pallavi ma'am. Thank you, Manjusha Sherkar ma'am. She was the chairperson last year of Women Committee, and all the faculties, all the executive board members, all the branch office bearers, and all the delegates for sharing your valuable time with Maharashtra IIP. And thank you, Pallavi ma'am, for your backup support. Thank you all. Thank you.
Thank you.
Thank you.
Good night,
Thank
ma'am.
you very
Thank you,
much.
Good night.
everyone.
Good
Good
night,
night.
ma'am.
Good night.
Thank you and good night.
Thank
Good
you.
night, Prabhu sir.
Thank
Good night,
you.
Thank you
ma'am.
very
Good
much.
night all. Thank you.
Thank
Thank you,
you.
sir.
Thank you.